This program is intended for those recovering from a heart attack and is designed to give guidance on how they may enjoy a speedy recovery. Every year, many thousands of people suffer a heart attack. The vast majority not only survive, but return to full health and activity. Recovery depends on both medical care and on the attitude and lifestyle of the patient and his family. Your doctor, in consultation with a cardiologist, will advise you on the medical aspects and may prescribe certain drugs for you. Heart attacks are serious events, and they are most dangerous in the first 12 to 48 hours. During this time, you may have been treated in an intensive care unit, followed by some 7 to 14 days in hospital. The job of the heart is to pump blood to all parts of the body. It receives its own blood supply through small arteries called the coronary arteries. If these become diseased, the walls thicken, reducing the inside diameter and the amount of blood passing through them. If the walls get too thick, then a blood clot can form inside the artery, and the blood supply to a portion of the muscle of the heart will cease, and the muscle will be damaged. Usually, but not always, the heart attack starts with a severe pain in the chest. Because the small area of reduced blood supply makes the heart very irritable, it is necessary to observe the action of the heart closely for a day or so. After this, the heart muscle starts to recover. There may be a complete recovery, or a small scar may replace the affected part. After leaving hospital, it will take 6 to 10 weeks for the recovery to be complete. You can do a great deal to help this recovery if you have the right attitude and apply a few common sense rules to your physical activities. There is no need at all for you to go to bed when you arrive home. Most people feel tired and easily fatigued after a heart attack. A long lie-in in the morning, a nap in the afternoon, and early to bed at night are all good for you. Nevertheless, you should get up and rest every day and take walks around the house and garden, even in the early stages. Gradually, your exercise can be increased, but you should not overexert yourself at any time. After 2 weeks at home, you can increase your activities and need not be afraid to walk upstairs. By 4 weeks, most light housework and gardening should be well tolerated. However, try not to be obsessive about tidiness during the first few weeks, as some housework is both strenuous and tiring. Walking is an excellent form of exercise in the early weeks, as it can be progressively increased by walking further and further distances. The golfer may start to play again after 4 weeks or so, starting with a few holes first and gradually increasing. If you are not accustomed to physical activity, you are encouraged to take regular exercise, though always within your capabilities, as a completely sedentary life is to be avoided after a heart attack. Swimming and gymnastic exercise are good for you, provided you avoid sudden, strenuous or violent exertion. To be afraid of performing any form of exercise is a very bad attitude and will delay your recovery. One word of warning: avoid, when possible, going out in very cold or windy weather. You should consider whether your mental outlook to work and life have not contributed to your heart attack. Many patients have had a rather obsessional attitude to their work, preferring it to hobbies and relaxation generally. In future, try to leave your work and forget about it at home. All forms of hobbies are mentally relaxing and interesting for themselves. Start reading all the books you've been promising yourself, and play all the records you've bought and never had time to listen to. Watching the TV is better for you than worrying about the details of your work. It is quite natural for patients to be depressed when they go home from hospital after a heart attack. It is a major event in your life. and may leave you fearful for the future. Remember, it is also a shock for your family, who will have had worries of their own. It is all too easy for tempers to become frayed, and for emotions to boil over, neither of which is good for you. Patience and tolerance have to be displayed to the full. In time, the irritability and depression will vanish, and your old self will reappear. Naturally, if you are still working, you will be anxious to return as soon as possible. This you can do 6 to 10 weeks after your attack, though it is best to have a period of part-time work before going full-time. If your job involves physical exercise, you should consult your doctor as to its suitability. Even if your job is sedentary, you should consider decreasing your commitments, as doing too much may well have contributed to your heart attack. In future, you should try to lead a calm and placid life, avoiding anger and emotional upsets. Your doctor may advise you on your weight, especially if you are overweight. Being overweight is an extra stress for your heart, and you will feel much better when you are nearer your ideal weight. Whether overweight or not, probably everybody should be advised to cut down on animal fats, but some people require stricter diets to control the fats in the blood. Smoking is a major cause of heart attacks, and you are strongly advised to give it up. Alcohol, on the other hand, is not harmful in moderation, say 2 pints of beer or 2 to 3 measures of spirits a day. Social drinking can be pleasant and help you to relax. Car driving is best avoided for a few weeks after your attack, and remember you are legally obliged to inform the DVLC at Swansea before resuming. When you start again, try not to get involved in stressful situations such as rush hour traffic. A heart attack may disqualify you from holding a heavy goods vehicle or public service license. And if you are a professional driver, you may have to find other work. It is important to avoid unnecessary restrictions in your lifestyle, as these can lead to frustration. You can resume a normal sex life after 2 to 3 weeks. Your doctor may well prescribe tablets for you to take. These may be required for a variety of reasons, such as to help control the blood pressure. Be sure to take them regularly and to follow the instructions carefully. Do not run out of tablets. Though women are less prone to heart attacks than men, they nevertheless have special problems. If of childbearing age, you are strongly advised against taking the oral contraceptive pill, which can increase the likelihood of a further attack. You can obtain advice on alternative methods of birth control from your doctor. The use of female hormones at the time of the menopause is also unwise. The family, friends, and neighbors can be of the greatest assistance in recovering from a heart attack. They should ensure that you are relieved of the heavier tasks such as shopping, heavy gardening, spring cleaning, etc., etc. But avoid wrapping you in cotton wool. You will naturally be concerned about whether you may suffer a further heart attack. While heart attacks are more likely to occur in patients who have already suffered one, the great majority of patients never have another attack and have many years of normal life expectancy. If, as is common, your heart attack was associated with pain in the chest, you will be apprehensive about any chest pain you may suffer. Remember that there are different kinds of chest pain, and most of them quite unassociated with your heart. Pain similar to that you suffered during your attack may occur when you are exercising yourself. It will usually disappear rapidly when you rest, and is a useful warning that you are doing a bit too much. Report it to your doctor on your next visit, and he will advise you on how it may be avoided or treated. Should the pain appear whilst you are resting and does not disappear within 10 minutes, it is best to contact your doctor immediately. Do not worry about disturbing him regardless of the time of day or night. He will be quite aware of the need to provide quick and effective treatment in the unlikely event that a further heart attack has occurred. Having a heart attack is often a salutary warning that you have been overdoing things, and it is time to slow down, relax, and take your health seriously. Remember, you are one of thousands, the great majority of whom will live a full and enjoyable life. Many find that a heart attack makes them take stock of their lives, and often this leads to a greater appreciation of what is good about life and how best to enjoy the years to come.